Um, Bismillah ar-Rahman ar-Rahim. Thank you very much. So my presentation now is about the risk stratification in the DAR risk calculator, looking specifically into two important new points, which are age and duration of diabetes. Now, of course, the most important point for anyone is to decide whether they fast or not, whether that decision is advice from the healthcare professional or indeed from the person with diabetes themselves. And when it comes to the 2 points of does age matter or does duration of diabetes matter, I'm afraid that the information up to recently has been a bit maybe absent. So in the newest risk calculator by DAR and IDF guidelines have looked into these points. So as you can see here, we have a point for duration of diabetes over 10 years or equal to 10 years, and also some consideration for age, but qualified by that the person does not have home support. And that actually takes a heavy point of 3.5. So the question really, are these points justified? When it comes to the age, does age matter? Usually this applies to being old rather than being young. Not many people are concerned about being young. I wish I was, but being too young in type 1 diabetes is sometimes of a concern. And we have published the data from the DAR Global Survey just over 1 year ago on the type 1 people with diabetes, where the data was split into those who were adolescents below the age of 18, and these were 370 persons versus those who are above the age of 18, equal to 18 or above. And as you can see from the figures here, whether the average number of days fasted, whether they wanted to fast or not, it does look like the younger person is able, because probably they are a bit fitter physically. Being the age of 15, 16, 17 or so, they're probably healthier, had type 1 diabetes for shorter duration, unlikely to have complications, and probably they want to fast and feel adults. When it comes to rates of hypoglycemia even, this was 55.6% in the younger and 62.6% in the older group. And statistically, that was not statistically significant. So there was some differences, but nothing to be of concern. Emotionally, traditionally, we look into a 13, 14-year-old and we probably say they are too young with type 1 diabetes, they should not fast. But I don't think that the age itself is a concern here. It is the ins and outs, the details of the diabetes of this person. And this very much matches what our colleagues from ISPAD have recommended for Ramadan for young people, where they said they should fast if they have fulfilled the certain criteria, which exactly what I mentioned: well-controlled, not frequent hypos, checking, have access to the right services, and so on. But being older in age is usually of more concern. But unfortunately, this seems to have not been clear in previous guidelines. This is our first guidelines in 2005. And here you can see that we have mentioned old age with ill health. So not just the age, but the age with ill health. And we have put a blanket as high risk. This continued in 2010, old age, again with ill health, in our guidelines with the ADA. Our colleagues who did the same guidelines as a group from the global group and published it into 2015, they still put them into the high risk and said elderly patients above the age of 75, and did not mention here it's a bit bigger, so elderly above the age of 75. So they specified the age now more than 75, not related to health, and they said they are categorized as high risk. However, when you look again, it was mentioned that they may choose not to fast. So it wasn't very strong advice. The South Asian Health Foundation UK guidelines, which I'm proud to be part of, age was not mentioned at all, and duration of diabetes is not mentioned either. So in UK, age doesn't matter, and it's not mentioned. Duration of diabetes also has not been mentioned. Our pre-last guidelines with the IDF, we went to the same category of duration of diabetes is not mentioned, and age was only concerned if there is ill health and was considered as very high. The Canadian recommendations, again, age was not mentioned and duration of diabetes was not mentioned. So very clearly, long time ago, that we said that healthcare professionals in this important issue of the Journal of Pakistan Medical Association, when they had a supplement on diabetes in Ramadan, that healthcare professionals should address the risk of fasting in all people by assessing their overall health status, comorbidities, cardiometabolic, geriatric syndromes, and frailty. Frailty is a very important aspect, but duration of diabetes was not mentioned. So does age matter? Do we have evidence that being older does matter? We have published the type 2 diabetes data from the survey for 2020, and we split the data into according to age. There was a group of patients with 11% in green of below 40 years, and this is very remarkable figure if you would think that diabetes in Western society is mostly a disease of being older. But indeed, the being older was only 18%. The vast majority, 70% of diabetes in the survey is between the age of 41 to 65. Now, if you look into comorbidities, and here is the color code, green is below 40, brown is the above 65, and the in-between is the pinkish orange. And for every single complications, the scale goes much, much higher between the young, below 40, and the more mature, I will not say old, but the more mature above the age of 65. When you look into deciding to fast in blue, that was 70% in those above the age of 65 versus 91% in those who were young, below the age of 40. But when it actually comes to the actual number of days fasted, once they fast, there is no major difference between the age groups. If you look into rates of hypoglycemia, it's going higher with age. 9% in the below 40 to 17% above the age of 65, and the 41 to 65 is in between. And if you were to look into, this was the breaking the fast. If you look into the actual hypoglycemia, 15 to 17%. So higher in older group, but not massively higher. Severity of hypoglycemia we calculated with admission to hospital or attendance of emergency department. And again, this is broken into age categories. So when you add both problems together, this occurred in 11.6% of the population of the above of age 65, and it was only 1% in those who below the age of 40, and the in-between is 6% in those who are between 41 to 65. When you look even again to hyperglycemia, again the same trend, 12% developed it in the young, 19% in those who are above the age of 65. So what I've shown you now, that age indeed does matter, with a very clear stepwise approach between those who are below 40 to up to those who are above 65. Come the point of duration of diabetes. Do we have evidence of this? Well, as I mentioned in the risk calculator for cardiovascular disease that we've developed in Emirates, we look into age. We look into age above the age of 50, and we consider them as with potentially higher cardiovascular risk. Indeed, the ADA, in the latest recommendations a year ago, they started to look into duration of diabetes. So durational diabetes doesn't, of course, has a bearing on comorbidities and complications of diabetes. Does it apply to Ramadan fasting as well or not? Well, here is the split of our population. 61% are of less than 10 years duration, and those who are over 20 years are 9%, 30% are between 11 to 20. So we can say that 40% of the population are indeed over 10 years duration. Now, again, the complications are very much the same. The split was equal, but when you look into HbA1c higher in the older group, those who are achieving good control were higher in the shorter duration of diabetes. And if you look into the information about duration and age, the vast majority of the people who are with short duration of diabetes are people in the younger group. So between 41 to 65, and indeed below 40, this was 16.5%. Very rarely you would find someone with long duration of diabetes, type 2 diabetes, who is below age of 40. Obviously, that would mean that they have developed it in their 20s or so, or in their teens even. Comorbidities and problems, they're exactly the same pattern as age. So as you can see, here is the people of less than 10 years, 11 to 20, 20 over 20. For every single complications or comorbidities of diabetes, the graph goes upward with increasing duration of diabetes. Now, when it comes to Ramadan fasting, well, those who are young, they fast longer. The percentage of fasting is higher compared to those who have a duration of diabetes of much longer, 20 years. But when they fast, the difference in number of days is not massive. When you look into breaking the fast because of diabetes-related complications, it goes from 9.2% to 11.7%. So there is some increase in that as well. The hypoglycemia, daytime hypoglycemia, was very much different. 14% in those with short duration versus 24% in those who are over 20 years. Mean number of days of hypos was not terribly different between one and the other. The severity of hypoglycemia was very much related to duration of diabetes as well. 4% versus 17%. That is over fourfold between those who have short duration versus long duration. And the cutoff, the split goes clearly here above the age of 10 years. Hyperglycemia, exactly the same pattern. So 18% in the long duration, 12% in the short duration. And again, the frequency of it is very much related to the duration of diabetes. Severity, again, going to hospital or ER, it's rare to be admitted, but it goes higher with ER visits from 0.7% to 1.7%. Together, we're talking about 1% to double to 2.1% in those who are poor. So in conclusion, ladies and gentlemen, the percentage of people fasting, the rate of hypoglycemia during Ramadan, the severity of hypoglycemia during Ramadan, the rates of hyperglycemia during Ramadan, and indeed the severity of hypoglycemia during Ramadan fasting are related to both age and duration of diabetes. And it seems that these are important factors. So hence their inclusion in the recommendations and the risk calculator seems to be quite logical for all of us. Thank you, and I look forward to your questions.